Good afternoon, everyone. Today, a further 16 COVID-related deaths were sadly reported in Northern Ireland. My deepest condolences go to the loved ones of those who have sadly passed away. Yet again, we see the destruction this pandemic causes and the heartbreak it leaves in its wake. Once again, from this podium, I plead with everyone to never underestimate this virus and to never let their guard slip. We are making progress in forcing down infection numbers, and when I say we, I mean people right across Northern Ireland who are abiding by the regulations and the restrictions. Staying at home is making a difference. The R number has been moving in the right direction, and we have to sustain and build on that progress. We have to stop COVID-19 spreading and ease the pressures on our health and social care systems. To keep staying at home, if you have to go out, keep your distance from others. Avoid, in particular, crowded indoor spaces with no ventilation. We must keep washing our hands, keep covering our faces. We all know the drill by now, and we have to stick with it. It still, frankly, beggars belief that there are still some people in our midst who deny or play down the true scale of this pandemic. We still have those armchair experts who spout simplistic ideas and snipe at everything and try to undermine what work is being done by those heroes in our health service. The reality is we, as a health service and as a society, are living through the challenge of our lifetimes, the battle of our lifetimes. It is a challenge that is complex, all-consuming and relentless. There have been many tough days from the onset of this pandemic, but similarly there have been many examples of collective and individual heroism, and none more so than from our health and social care workers. There are no words to properly convey what they have done for us. We will never be able to repay that debt. Last spring, we stood on our doorsteps every Thursday evening and clapped for our heroes. And whilst it was a thoughtful display of support, I think we all knew that it was never enough, and that they deserved more than just our thanks and well wishes. So at the end of last year, I asked my officials to rapidly develop an option to administer a one-off pro-rated payment for all our health and social care workers. And today I'm pleased to be able to announce that I have decided to and approved to proceed with a special recognition payment of £500 for Northern Ireland's health workers. And that was subject, of course, to final Department of Finance approval. And that's all our staff. So our doctors, our nurses, our care home workers, our domiciliary care workers, including those working in the independent sector, our admin staff and our estates teams. This is similar to a scheme in Scotland. But to head off some of the nitpicking potentially from the media, let me make clear that I value all our staff. Despite what you might have heard recently, there is no neat dividing line between frontline and non-frontline. As Health Minister, I value each and every personal contribution equally because it keeps our health service running. Try running a hospital without cleaners, porters, cooks, IT specialists, managers, PPE supply staff, payroll staff, drivers, administrators, booking in appointments. They're all hugely important and integral to the overall work of our health and social care system. This payment will not be without its challenges, because for some people, especially some of our lower paid workers, it may in fact have an adverse impact on their social security payments or supports that recipients may be claiming. So I have written to the Ministers of Finance and Communities asking them to urgently consider and support the issue and to engage with the tax and benefit authorities in the UK to request that these payments are excluded from considerations in this regard. And whilst the UK nations are still negotiating a new pay deal for our National Health Service Agenda for Change staff, this payment, and I want to be clear, this payment will have no bearing on that. I'm also acutely aware that it's not just our staff that have stepped forward over the last 11 months, but also our students. Recently in England, the Nursing and Midwifery Council reintroduced emergency measures similar to those implemented in the first wave of this pandemic. Those measures have enabled final year nursing students to take paid clinical placements. Taking account of the profound pressures of this pandemic and significant nursing workforce challenges, this is something I was also eager to explore as an option for supporting our own work. The paid placement option for our current third-year students, they would be faced with a number of major detrimental consequences. This cohort of students have already experienced significant disruption to their pre-registration programme during their second year, and that was owing to the Nursing and Midwifery Council emergency standards that were in place last year during the first wave. So introducing a paid placement option would have imposed further major disruption on these students at an important stage in their final year pre-registration programme, and will have likely prolonged the programme and actually ultimately delayed their Nursing and Midwifery Council registration and subsequent joining the registrant full-time workforce. So my objective is to get these students across the line and into the mainstream workforce as quickly as possible, where they want to be. However, I'm also hugely mindful that our students have made an enormous contribution and continue to do so. So today I can also confirm that I have decided to proceed with a flat rate, one-off special recognition payment of £2,000 to all non-salaried qualifying students, those who have been on clinical placement over the period between the 1st of October 2020 to the 31st of March 2021. The qualifying courses are the Nursing and Midwifery course, the Allied Health Professional, Social Work and Physician Associate pre-registration programmes, which have been commissioned by my department from Queen's University Belfast and Ulster University. Finally, we must never underestimate the contribution of our carers. Carers have been amongst the greatest unsung heroes of the coronavirus pandemic. So I can also confirm that it is my intention to provide our carers with a one-off award as a small recognition for the exceptional contribution that they make to our society. However, unfortunately, there is still more work to be done in this regard, and it would be significantly more complex to administer than the staff payment. It will also require engagement with executive colleagues, and I hope to be able to meet some of our carers in the days ahead to try to find a way forward and a mechanism on this regard. Throughout this pandemic, an overriding priority has been to protect our health service, to keep it standing, supporting it so it can support you. So far, that has been done at great cost, and that is thanks to the staff at all levels right across our health service. I'll now move on to Dr. Michael Mcbride, our Chief Medical Officer.
Thank you, Minister, and good afternoon, everyone. Firstly, I would wish to add my sincere condolences to the family and friends of all of those who have lost their lives in the last week to this pandemic. Sadly, it's sometimes all too easy, or perhaps easier, to forget about what lies behind those numbers, and we never should. We should never impact forget the impact that is on those bereaved and those who are grieving at this time. I would now like to take you through the pandemic and the spread of the virus in Northern Ireland in the past week. A few introductory comments before showing the first slide. As a consequence of the restrictions that were introduced by the Executive on the 26th of December, we have seen the number of new cases continue to fall, and the R number based on new cases remains less than 1. We know that the epidemic will continue to reduce and shrink, as the Minister has said, provided we all continue to do what we're doing and we know what we should be doing. The current estimate for R, based on hospital admissions, is now also at less than 1. And while the numbers for hospital admissions remain and may have passed the peak, they remain at an extremely high level. And I think it's important that we remember they will remain at an extremely high level for some many weeks, and that will ensure that, unfortunately, our health service staff will remain under very severe pressure in the coming weeks. If we could maybe just turn to the first slide. This shows the rolling average of new cases per day, and it has fallen from a peak of over 2,000 in the period immediately after Christmas to now just over 700. The level of testing in Northern Ireland remains high. Test positivity rate, as we can see on this slide, has fallen from 17% last week to 12% this week, and that reflects a reduction in community transmission as opposed to any reduction in testing. I think it's also important that we bear in mind, while it's welcome to see that fall in test positivity rate, it remains well above the recommended WHO level of 5%. A level below 5% would indicate that we are bringing community transition under control, and clearly we have a long way to go before that situation is reached. This slide shows the 7-day rolling positive tests per 100,000 across all of the local government districts. And as we can see, there's been a decrease in the last week across all of the local government districts. There are 3 of those districts that continue to have a high incidence. That is Armagh City, Banbridge and Craigavon, Mid-Ulster and Newry, Mourne and Down. If we now compare how we are faring across the common travel area, the numbers of infection are currently changing across the UK. This is published data as of the 21st of January, which is why the prevalence is slightly higher in this slide for Northern Ireland than is currently the case. Northern Ireland, as we can see, which is in the middle blue bar in the chart, has a higher prevalence than Scotland or Wales at this time, but a lower prevalence than England and the Republic of Ireland. As I said earlier, while the daily numbers of new COVID-19 admissions is now starting to fall, they remain at their highest ever level. The number of COVID-19 hospital inpatients is extremely high, as we can see from this slide, and has only slightly reduced from its recent peak. COVID-19 inpatient numbers are expected to remain high and at this sort of level for some weeks. And as I've indicated already, and as Minister has said, this will result on sustained pressure on our health service and those working in the health service. And finally, the last slide looks at ICU occupancy. This only looks at ICU occupancy in COVID-positive patients. And as we can see here, ICU occupancy is continuing to rise from its current highest ever position. As we know, there is a lag period between the cases, new positive cases, admissions to hospital, and then admissions into intensive care. And I anticipate we will see continued pressures on our intensive care for many weeks. So finally, just to conclude, as the Minister has said, the decisions you make, the actions that you are taking are reducing the number of infections, are reducing the number of people who become unwell and require hospital care. And I want to thank everyone who is adhering to the restrictions and everyone who is following the advice. What we all must now avoid is dropping our guard. We need to be extremely careful around the relaxation of any of the current restrictions, and certainly to avoid any relaxation too early before we're seeing further and sustained reduction in community transmission, before we see the pressures on our health service significantly reduced, and before we have more people at risk vaccinated and protected from severe clinical disease. Thank you, Minister.
Thank you, Michael. I'll now hand over to Dr. Patricia Donnelly, the head of our vaccination team.
Thank you, Minister. I'm very pleased to have the opportunity today to provide a further update on the Northern Ireland vaccination programme. We stand at a very important juncture in the programme because we're now in a position to accelerate the programme's rollout. That's really good news. In a moment, I'll spell out exactly how that will happen. But first, I want to outline some more positive news. We received a further delivery of the Astrazeneca vaccines yesterday, and another delivery is scheduled for next week. And when that arrives, we should have sufficient Astrazeneca vaccines to allow GPs to cover everyone in the 75 plus age group and to begin vaccinating the over 70-year-old population. Be assured that when the vaccines arrive, they're distributed as soon as possible to GPs. In general, supplies of both AstraZeneca and the Pfizer vaccines remain steady and in line with expected schedules. And that allows us to push ahead with the rollout. From tomorrow, we will begin a twin-track approach. Later this week, the role of the 7 regional vaccination centres will be expanded to begin vaccinating members of the public. As GPs focus on the 70-year-plus age group, the vaccination centres will in parallel offer vaccination appointments to 65 to 69-year-olds. These will be bookable online. Further details of a booking portal will be published very shortly, as well as a telephone helpline for those unable to use online booking. And it is important to emphasise that GPs and the vaccination centres will both have a role over the next month in vaccinating people who are clinically extremely vulnerable. They will be contacted by hospitals and by GPs. The centres will concentrate on clinically extremely vulnerable patients who are frequent hospital attenders. In parallel, the GPs will vaccinate others on that clinically vulnerable list. I can also confirm that we intend next month to launch a comprehensive digital register to enhance the recording and reporting of vaccination numbers. This will help to keep the public informed of the work that we're doing. We're making important progress in this rollout, building on the strong start that we made in December. And please, please don't let anyone tell you otherwise. I fully understand the frustration in the community. People want their vaccination as soon as possible and they want certainty about where they're getting it. I would again appeal to people to be patient. We can only move as fast as the vaccine supplies allow. And as much as we'd like to vaccinate everyone now, that just isn't possible. So we're dependent on those who are manufacturing the vaccines and distributing them to us. We are not unique in the challenges that we're facing. This is a global race to get supplies. Countries all over the world are vying for supplies. But we've made an encouraging start, but there's a long road ahead of us. Please also be patient with those at the sharp end of this programme, the GPs, their staff, the teams at the vaccination centre, the teams on the booking lines. They're working flat out to get this done. Their priority is to reach the right age groups, to get it done quickly as possible and to keep wastage levels as low as possible. This is a huge logistical challenge. We have 2 separate vaccines with separate requirements administered in separate locations. Of course, it would be easier if we had unlimited supplies of just one vaccine available to everyone on a first-come, first-served basis. That's not only not possible, it wouldn't really be fair anyway. So please bear with us, support our vaccinators as they push ahead with this vitally important programme. Thank you.
Thanks, Patricia. Marie-Louise.
Hi, Minister. Can I ask a question around quarantine? England has set out plans for quarantine that focus on travellers from the most at-risk countries. Today, Nicola Sturgeon says she's concerned that those plans don't go far enough. Minister, what's your view on this, and when will the Executive announce a decision around this, because surely this falls under the category marked urgent?
Thanks, Marie-Louise. Look, it's something I wrote to the Executive over the weekend when I saw a direction of travel that was obviously coming from Westminster in regards to asking our COVID Executive Task Force actually to look at this as a proposal that the Executive could adopt as a whole. It's not something that would solely sit within Health's remit to deliver such a programme. We were involved, myself, Deputy First and First Minister's Chief Medical Officer were involved in a Four Nations call earlier today, where the bones of this process was set out to us as to exactly what it means. There's a further call this evening to further thrash this out. But what the First Minister was at pains to allude to and to highlight again is something that I myself have raised as well, that we do need that coherent sharing of traveller information with the Government of the Irish Republic to ensure that we get the full utilisation out of any international or mandatory isolation programme that we introduce here in Northern Ireland.
Minister, moving off the COVID topic, if we could just for a moment, but something just as equally important in the news today, the Mother and Baby Home Report. It clearly sets out how some hospital staff were instructed to treat pregnant women in homes with, and I quote, a cold shoulder. Now, some midwives, GPs and social workers, we were told, were complicit in what happened to them. Based on that information, and since it does mention those professions within working in the Department of Health, do you think that the Department of Health owes these people an apology?
Most certainly, Marie-Louise. Now, I'll do that as Health Minister. I'll provide that apology to them. You know, it was a harrowing report to read. It was actually a piece of work that was conducted by my department. We actually led on it, and the First and Deputy First Minister's TEO are now taking it to the next step under the chairmanship of Judith Gillespie. It's not a good piece of our history here in Northern Ireland. It's not a good piece of our history here on this island, and it's something that I will be doing to correct those wrongs that were done to so many young girls and women across Northern Ireland at that point in time, because it's something that we have to ensure that the corrections and the apologies and the recognitions are made for the hurt and the damage that was done to so many women and children. Mark. Hi, Mark.
Good afternoon, Minister. Question just on schools. Of course, Boris Johnson, the Prime Minister, announced today the schools in England are unlikely to reopen to all pupils after the February half-term break. He said, of course, the final decision would be dependent on meeting vaccination targets. What do you see the situation being here in Northern Ireland with regards to schools? Do you believe that pupils will be able to return to school after the half-term break, or do you think it will more likely be into March before they will be able to return to school?
Well, Mark, I think one of the things that people will be aware of is I don't discuss what's coming to an executive before it comes, but I think it has been clear and is in the public domain that the Education Minister intends bringing a paper to the executive tomorrow for discussions on his travel of thought and his process as well. But I think we're already assured that schools will be and do remain closed until the mid-term break. And at that point in time, there will be an assessment made. But I would be assured from conversations with the Education Minister that he has a recommendation or a number of options to bring to the Executive tomorrow for further discussion.
Okay, and second question. The Office for National Statistics has been looking at the symptoms for the new variant of COVID and said that cough, fatigue, sore throat and muscle pain may be more common in people who test positive for the new variant of COVID. Can we expect updated guidance from the Northern Ireland Executive as to what the symptoms might be that people should be looking out for and when they should get tested if they develop any of those symptoms? Or is it the intention to stick to the core three symptoms that we have at the moment?
Mark, I'll let the Chief Medical Officer pick up on that specific. Thank you, Minister. Thank you, Mark, for the question. We have no immediate plans to change the criteria under which we advise people to present for a test. As you know, we do keep the symptomatology under a continuous review, and we have changed it in the past. I think certainly as we move into spring and into summer, and certainly as case numbers fall, again, we will look at the case definition to see whether or not there is benefit in extending it further to ensure that more people come forward for testing. I think the crucially important point here is if you have symptoms, you need to get a test. If you're advised to get a test, you need to get a test. And we are making very significant progress in pressing down on this pandemic. And it is crucially important that if you test positive, that you self-isolate at home. So please follow the advice. Please continue to the efforts and the success that we're having in pressing down on the current levels of transmission in our community. And please reduce the pressures further on our health service.
Okay, thanks, Mark. Rebecca Black, PA. Hi, Rebecca.
Hi, good evening all. Wanted to ask, obviously case numbers are starting to drop, but they're dropping slower than they appeared to drop last year. Is this spike of the pandemic proving a lot harder to slow down than previous spikes?
I'll let Michael pick up on the specifics of that, Rebecca, but what we are seeing in this wave as well, and it has to be acknowledged, we're starting from a very high point this time in regards to the positive cases we are seeing, and those cases were 100,000. So when we introduced these measures back on the 26th of December, it was from a very high point, so it will take us quite a while to get back down to levels that we would want to see. Michael.
Thank you, Minister. Thank you, Rebecca, for the question. We are thankfully seeing a rapid decline in numbers of new cases, and the R number, that all-important R number, is and remains below 1. And as long as it remains below 1, the epidemic here in Northern Ireland will continue to shrink. And it's thanks to the collective efforts, as the Minister said, of everyone who's following the regulations, following the advice, that's being achieved. As we now know, however, the new variant, the B117 variant, otherwise known as the UK variant, is prevalent and is increasing in prevalence across the UK, the Republic of Ireland, and here in Northern Ireland, and certainly present in higher numbers than it was pre-Christmas. Sadly, that's only to be expected because it's a fitter virus. It transmits about 40 to 70% more efficiently than the old variant. So the job just got harder. The efforts that we will need to put in to keeping transmission low will be greater. And those situations where the old variant may not have transmitted, this new variant will. So what we cannot afford to happen is for the numbers to fall and then plateau. We need to see sustained reduction in the level of community transmission, because any relaxation in the current measures with this new variant present means that we will return to a period of very rapid growth again, and that's something that we must guard against. We need to protect people from severe disease, and we certainly need to protect our health service, because we would then be starting from a very, very high baseline.
Thanks. Dr. Mcbride, you indicated that the new variant hadn't quite sort of taken a grip in Northern Ireland before. So from what you're saying today, has that increased, and is there any indication of the prevalence of this strain of the virus?
Yeah, I mean, I think there's been some unfortunate commentary and coverage around whole genome sequencing in Northern Ireland. We are punching well above our weight internationally and at a European level in terms of per capita sequencing of the new variant. We have seen a growth in that, certainly estimated at less than 30% prior to Christmas. It changes on the weekly runs that we are performing, probably now somewhere in the region of between 40 and 50%. As you know, the Office of National Statistics produced a report which had a heavily caveated report towards the end of last week with a health warning saying the numbers are small in Northern Ireland, so please interpret with caution. So with very broad confidence intervals because of the small sample size in their analysis, they were estimating that the prevalence was between 40 and 70%. I think it's less than that, and certainly the figures from Northern Ireland would suggest it's certainly less than 50%, but it will increase. This virus transmits more readily. The good news is that the measures that we have in place will reduce the transmission of all variants, but it just means that we have to work harder and to stick to them, those measures more rigidly and carefully, as the Minister has said.
Thanks, Rebecca. Tara McLaughlin, Downtown Cool.
Yes, good afternoon, Minister. Just a question around the bonus you mentioned there for healthcare staff. I know that it obviously needs to go for approval. When can they expect to get this? And in terms of final year medical students as well for the one-off payment?
Look, Tara, it's something that my officials have been working on. It's something that we actually have our own finances in place within the Department of Health. So the reason it needs approval from the Finance Minister has been done by ministerial direction. So as soon as we can get all those processes in place, plus maybe some background work in regards to if we can see if there is further mitigations to make sure nobody is adversely penalised in regards to tax or implications to benefit payments, we will be able to proceed with the payment to our direct staff as soon as possible, and then work it out across those other categories as soon as we practically can. But it's money that we have, it's money that we already have assigned and have in place within the Department of Health, so it's money that we can proceed with giving out once we get those insurances and processes in place.
Thank you, Minister. And a question for Patricia as well in terms of the vaccine. I know we have completed health and social care staff. I was just wondering, do we have any details for the percentage of the workforce that have taken up the vaccine?
Thank you for the question. We don't have exact figures, and the digital platform and recording system that I was talking about earlier will be online in February, so we'll have more detailed information. I think that we believe that it had a high uptake from the early groups that came forward, but we have a lower uptake from the social care groups that we were trying to call forward in the last few weeks. And that is disappointing. We've tried a number of ways to encourage them to come forward, and they've still got opportunities if they do want to come forward and be vaccinated. But our impression is that a very good level of uptake. We were aiming for 70%. I don't think we'll be very far off that.
I think, Tara, one thing to be clear, and Patricia highlighted there, although we're moving our regional vaccination centres to facilitate the over 65s, they still are open to healthcare workers across the sector who still need their first vaccination as well. So they're not being closed to that portal, that healthcare portal as well. So if anybody still does need the vaccine, anybody still wants it, or have missed it, or have changed their mind, you know, that opportunity is still there for the utilisation of our regional centres. Niall Denny, Newsletter.
Hi, Minister. We're moving on to phase 2 of the vaccination programme. That includes, by your department's own estimate, around 458,000 people, with a target of completion by the end of February. Can you give any sort of a guarantee that we'll hit that target? That's quite an ambitious target, and it would take between 13 and 15,000 vaccines per day in Northern Ireland. Can we hit that?
Niall, I'll maybe ask Patricia to pick up on those specifics.
Thank you. Yes, you're correct. that part of phase 2 of the programme actually is beginning this week. We're expecting to begin it next week, but we're launching it this week. It begins in February, but actually it's going to go on until March. So that isn't an end date. We recognise that it's much easier to call forward some of the age groups, but once we start to call forward the clinically extremely vulnerable, that takes a little bit longer. There may need to be special arrangements in place. There's careful planning around that. So that's all included in the phase 2. So it will go into March, but we do expect, we've got the 321 GP practices, we have the 7 vaccination centres, and if we have the vaccine, we'll open more vaccination centres. So we are throwing all our weight behind this to get as many people vaccinated as possible.
I think now, just to pick up on the point in regards to those who are extremely clinically vulnerable, those who are being called to the regional facility, as it is to give space, time and support that will take that extra time, that extra support for them to go through the process, to allow them to utilise the supports that those facilities will bring.
We've been hearing about disputes over the supply of Astrazeneca with the European Union. How confident are you in the security of the supply to Northern Ireland?
Again, now that's I know it's a conversation that's ongoing between UK government and EU officials, and I think even now the manufacturer and the CEO of Astrazeneca has come into play and into the conversation as well. To echo, I think the phrases that he's been using is that the UK is in advance of the EU in regards to the procurement, because the UK signed their contract 3 months in advance of the EU. We are working on a 3-monthly schedule in regards to manufacture, processing, and actually to supply. One of the things that Patricia doesn't allow me to do is to count any vaccine until we actually have it in hand. So she's quite strict and firm in regards to that, as to how we take forward our programme, and rightly so, because it allows us to manage what is a very critical and valuable product as we combat COVID across Northern Ireland. Patricia, do you want to touch on international supplies? Or?
Yes, thank you. We do get indicative supplies, and we get them some months ahead of time, but the supply distribution that we trust is the one that tells us this week you are getting and next week you're likely to get. So we plan. It's a just-in-time kind of planning, and we work with GP colleagues, we work with trust colleagues to tell them what is likely to come ahead. What I can say to you is that the plan and the distribution plan that was provided to us in December has been pretty much what we have experienced. So we have not experienced shortages. It's been exactly as was predicted. We would always want more, but that is a different issue. Certainly we're getting what we were expecting so far.
Thanks, Niall.